computer glitches. There she is. Welcome to Tuesday after a long, fun weekend. So what I was going to do is just read some symptoms of deep limbic problems, and so people kind of know what we're talking about. And I think one of the cool things about the limbic system is that, you know, just is it clinical or not? My limbic system is really overactive, and although it's less overactive than it was in the past, I'm just kind of prone to a lot of this stuff because I'm an empath, because I'm a feeler, because I'm a healer. You can tend to kind of pick up on things more easily. So if anyone's ever gone down one of the cool rabbit holes that Dr. Amen has of other types of practitioners that he's worked with that are really inclined to kind of picking up on other people's stuff and how to help them, I'd be very surprised if they didn't have an overactive limbic system. So I'm going to share just kind of the standard symptoms that we see. So experiencing frequent feelings of sadness, moodiness, negativity, low energy, irritability. And then these are some of the classic depression symptoms, especially if you go to your doctor and you kind of complain of some of this stuff, they'll have a discussion with you about medication. Having a decreased interest in other people, having a decreased interest in things that are usually fun or pleasurable, having feelings of hopelessness about the future, having feelings of helplessness or powerlessness, unexplained feelings of guilt, boredom, crying spells, suicidal feelings, not wanting to do fun things, sleeping too much, sleeping too little, eating too much, eating too little, chronic low self-esteem. So especially if you had trauma as a child, that can have a lot of effects on the limbic system. And then last but not least, having a negative sensitivity to smells and odors, which when you start talking about things like Alzheimer's disease or COVID, it's kind of interesting how there's that loss of sense of smell as one of the first things, which to me is definitely, you know, the emotional brain having an effect. It's affected in everything that we're doing, even just having this conversation. Certain things are firing and not firing, but just thinking of it from a perspective of, oh, that's another symptom that I need to think about and think about treating. So from a Chinese medicine perspective, I would love to hear more from you, Whitney, about what you kind of see as certain points in the body where people can have limbic symptoms or depression symptoms.
Yeah, absolutely. And good morning. I'm having a little technical difficulty here.
It's okay.
I would just say the other pieces with the deep limbic system, like a lot of people hear about the amygdala and that fight or flight response. And so that is part of the limbic system. And it's also where we bond. And so I think of postpartum depression is absolutely here. I had postpartum depression, which was really, really hard. You know, I remember being a new mother and everybody going, oh my gosh, aren't you so in love with your baby? And I'm like, yes, I think I am, but I can't feel it. And so that's where this is being affected. And then also your libido is here as well. And so it's not always hormonal. It can also, your libido can be affected here in this, because this area, this limbic system sets your emotional tone. And so it's going to determine how connected you are to people. And so that's why it affects the libido. We have to feel connected to people to be able to, for our libido to rise. And then also motivation as well. I think you had said that, and pain. So pain can get stuck in the loop here in the deep limbic system when we are in pain. So from a Chinese medicine standpoint, there's a lot of different organ energy systems that are affected, that come under this category. So we would talk about in Chinese medicine the heart and actually the kidneys and the spleen. And in Chinese medicine, the heart and the kidneys have a really interesting relationship. They are, it's the yin and the yang in the body if you're comparing those two. And so it is that emotional connection to others. So if this feels off balance, you could feel like social isolation and pulling away from people, places, and things. So, and then of course, with the irritability, there in Chinese medicine, the liver gallbladder is involved, and your, and somewhat your lungs as well are in Chinese medicine related to that. So I'm going to back up for a second here. So from a Chinese medicine standpoint, the Chinese description, we use the same words like heart, spleen, lung, but it's not what the Western definition is. So back in the 1960s, when Chinese medicine was being translated, the Chinese docs were there and the Western docs were there, and they didn't speak each other's language. And so they were trying to just, come together and figure out what each other's paradigm is. And so the Chinese would describe something and the Western docs were like, well, that kind of sort of sounds like the liver. We'll call it the liver. So we use words like liver, gallbladder, spleen, stomach, but it doesn't mean the same thing, because they did not, in China, thousands of years ago, they did not cut open the body to look inside and see what was going on. They looked outside and looked how nature works and said, okay, that's how the body must work. And so it was sacrilegious to open up the human body. So the human body was considered sacred and was not to be cut open. So the Chinese medicine looks at the body, mind, spirit very differently than Western medicine. So even though we use words like heart and spleen and kidney, it's not your Western description of that. It's the energetic channels that run in the body. So yes.
Why we say broken heart, like your heart isn't literally broken, but
right.
You're experiencing an energy block there.
Right, an energy block or too much or too little flow in that area for sure. Yeah. So when we talk about, the deep limbic system, I mean, there's so many parts of it. It's, the thalamus, the amygdala, the hippocampus, the hypothalamus, the inferior orbital of the prefrontal cortex, the anterior cingulate. So there's a lot of parts of the brain that are involved in that deep limbic system. And so when we have issues in this area, we've really got to differentiate and look at exactly what part is off balance. And so when we give Western medication and just, are like, okay, well, you're depressed, so it's this, that may or may not work. And so we want to really find somebody who is really well versed and educated on how the brain works. And we've learned so much in the past, 5 to 10 years. So we really have to make sure that we're keeping up with what is being found in neuroscience. And, I think the brain health coaches do a really good job with this. And obviously the Amen Clinic, psychiatrists and doctors there, I mean, they obviously get it, they understand. So it's really important that we don't just say I'm depressed and then, get put on a Western medication. Western medications are appropriate at different times. My belief system is there's always a time and place. But we really have to look at which part of the brain is being affected.
Yeah. We used to have this old workbook, and I don't know why we don't have it anymore, but it was my favorite thing because it was something I could share with anyone, especially children, and they would get it. Mm-hmm. Depressed. That means you have major depression. You go on an antidepressant, which is most likely an SSRI or an SNRI. You're anxious. You're diagnosed with anxiety disorder. or generalized anxiety disorder, you're put on an anti-anxiety medication, which is either an SSRI or a benzo. And we're talking about the limbic system does not need those. Those are like the worst thing you could give somebody with a limbic system issue. The limbic system, when it's not functioning well, needs norepinephrine and dopamine. And then if there is a serotonin issue on top of that, you need to treat that later, simultaneously, under the care of your physician who understands what you need, because it still is just like really weird to me. And I mean, I know a lot of people that haven't had a brain scan and are doing well on SSRIs, which is wonderful, but I think of it like a gambling game. Like you kind of got lucky, right? Because serotonin, I mean, if you have too much serotonin, like you're taking it and you don't need it, it can cause really big issues. And I don't understand why people don't Google that and just like research that instead of Googling and researching stuff that is just going to create them more anxiety instead of a resolution.
Right. Well, and for me, it's like, okay, so what exactly is causing the anxiety or the depression? Is it your internal perspective, or is there something external? Is there a virus going on that you cannot control and that is causing it? And so those two things need to be handled very differently. You don't like slap medicine on for both of those. And I mean, you really, there's so many different things that you can do. And so, you know, to me, this time in our world is really about going within and finding those quiet practices. And so, you know, whether it's, you know, meditating or yoga or, you know, Tai Chi and things like that, like we're in 2020, everybody on the planet should be meditating. Like, just as we breathe, we should be meditating, because we have to calm our systems down. We are in fight or flight constantly so much. And our bodies are not meant for that. Our brains are not meant for that. I mean, that's not how our human system was designed. It was designed to run from a tiger, be safe, and then, move along with, hunting and gathering.
Right.
So, yeah.
Just as a reminder for anyone that's watching us for the first time, Whitney and I are brain health coaches. We've been studying this for several years. And then Whitney's also studied Chinese medicine for 20 years. So she really knows her stuff. And you can go to brainhealthassessment.com at any time and find out what your brain type is. So if you go into it not really knowing kind of what your symptoms are, the questions are really great at kind of prompting you to reflect on how you might be feeling. If you know that you're depressed and you know that the things that you've tried up until this point aren't working, this is great and perfect for you, because you can kind of look at things from a brain systems perspective instead of a symptoms perspective. Right. Toxicity, Lyme disease, Epstein-Barr mononucleosis, those all attack the limbic system, and there isn't a magic pill for that. Like, you really have to do a lot of detox, a lot of meditation, seeing a specialist in those realms, which as you start to research, there aren't that many. So if you need a recommendation and are worried about those things, let me know. Because that's what we see so much at the clinics and your brain MD. You try something, it makes you worse, or it doesn't do anything because it's not getting to the root of the problem. Mold is a huge problem, especially, in the South. Lyme disease is a huge problem, especially in the Northeast and then, Wisconsin, that area. So those are big things that you might have no idea are affecting you that would be worth looking into. And of course, most of the time when I've been working with patients about things like that, they come in for their SPECT scan because they, read a book or saw a PBS special or know a friend that came in and we found out what was going on with them. And they had no idea that we looked at those things, because we look at their scan and we're like, holy crap, like, what have you been doing or living, or what has bit you? Because this is not a normal brain. Like, there's something big going on here that you haven't looked at this point. And that's why we need to use, our functional medicine doctors and our experts in those realms, because what is actually underlying going on with you for toxicity or infections is attacking your brain. Right. Your brain being attacked and we're alarmed. Now we need to back up, ask more questions, and see what's really going on and how to treat it.
And that's so much, I mean, that's why I feel so connected to the work that Amen Clinics does, is because in Chinese medicine, always, always, always is we are looking for the root of the issue. Like, what is causing it? I don't want a Band-Aid approach personally. I don't want that for my clients because it's just going to come up elsewhere in the body. Like, I want to know and figure out what the root is. And that's the beauty of the brainhealthassessment.com, that assessment, and, and potential, and going to getting a scan if that's needed, to be able to figure out what the root is. And so if you go into the doctor with these symptoms, they are not trained in being able to, unless they have some neurology background, because things have changed in neurology, in the last minute.
Right.
They have figured out.
Yeah.
So, one of the things that I think about in terms of from a treatment standpoint to get into the limbic system, depending on what your smell sensitivity is, are things that are calming, like lavender, and essential oils that are really gentle. I work with a doTERRA representative, because doTERRA is a really clean, good essential oil company, and you can go online and find doTERRA reps, and they will be able to figure out a blend that's for you if you're having sleeping or you're anxious during the day and it's your limbic system. Once you do that health assessment, it'll tell you if your limbic system is involved. And so there's so many different ways to treat depression and anxiety, and and bonding. If there's postpartum depression, there's so many things. Like, my daughter just turned 20 this past week, and 20 years ago, I had access to Chinese medicine, but I didn't have access to the brain health work. And, there's so much more that could have been done to help with the postpartum depression, which is really just, I think, one of the most, it's a very brutal experience, because you have this newborn that you can't feel that connection with, and then you feel shame and guilt because you can't feel the connection. And it's hard enough being depressed, but when you're supposed to be taking care of a newborn and you're supposed to be feeling all these feelings of magical love and everything else, and you can't feel it, it's an awful feeling. And I think of too, in terms of, fish oil is really, really important for the limbic system, because we need good fats for our brain to operate. But here's the thing, depending on which part of the brain is affected is depending on which type of fish oil that you need. Not all fish oil is created equal in terms of quality, and not all fish oil is equal in terms of the EPA-DHA ratio, because depending on which part of your brain you're needing that fat to go to, you need a different ratio. So, and the beautiful part is the brainhealthassessment.com, it's free. You go on and it'll tell you, like, this is the percentage of EPA, DHA, which is awesome.
I was blown away when I did my labs, and I was just doing the omega check, and this was like, several years ago, before I realized that we were actually measuring the EPA, DHA, and then the A something. And I had been taking our fish oil, our high quality fish oil, for years. So I expected my omega to be perfect model. And it was like wonky all over the place because I hadn't paid enough attention to my limbic system.
Mm-hmm.
I was much more worried about my temporal lobes, and you always need to treat those first, because I was feeling so much better from treating my temporal lobes and my basal ganglia. So I wasn't irritable, I wasn't anxious, I wasn't having these like waves of, feeling like an elephant was sitting on my chest. I was like, oh, this feels so good. I'm like, done. Like, I don't need to do anything else. And then I got those labs, and I was like, wow, like I need to like get my omegas like really in check as far as the ratio of everything. So
Right. It's just,
all this stuff is measurable.
Yeah. I mean, it's, and the thing is that depending on what part of the limbic system is affected will depend on, what supplements. So, I have clients who come to me as a Chinese medicine practitioner. They typically either are on medication and don't want to be, or they know that they're feeling off balance and they're afraid to go to their doctor because they don't want to be put on the Western meds that have all these side effects. Mm-hmm. So, in Chinese medicine, it's really interesting. The philosophy in Chinese medicine is that if you cause one negative side effect to another part of the system, it is the wrong treatment. So you either change the dose, you change the time of day that you're taking it, or it's the wrong formula. But you never in Chinese medicine ever, ever, ever sacrifice one system for another system. And so that is not the philosophy in Western medicine. The philosophy is like, the doctor's looking at one little piece and goes, okay, we'll take care of the toe, but it doesn't matter if the arm falls off, So we really need to take a look at what our expectation is for treatment,
Yeah. All the commercials, you can imagine what it's like. I'm like, I can't do it. But then it's like totally normal when I'm doing an intake and I'm like, oh, like, how have you been feeling so far on the new protocol that your doctor put you on? Like, oh, the normal stuff. I'm like, well, I don't know what the normal stuff is. Like, can you please describe further? Like, do you have these symptoms? Are these symptoms of depression better? Like, oh yeah, like I feel so much better. I just have no sex drive.
Right.
You're just telling me how you feel disconnected from your wife and that was making you more depressed and experiencing more shame and guilt. And now you're on medication that you feel better, but you're not able to have sex and be intimate with your wife. Like, it's like, I'm a slow processor anyway. It's like, that's just like, but then that was happening all the time.
Right.
I'm doing intakes and I'm like, this is not doing it.
It takes it. Like our society's like, that's just normal. It's like, no, that is not normal. That is not normal. What's really fascinating to me is that a lot of times people will go in and they expect to have negative side effects from Western treatments. And then they go to an alternative practitioner. They have one that needs to be adjusted. So they need to be communicating and talk to the practitioner. And then they're like, oh yeah, acupuncture doesn't work. I'm like, what? Wait a minute. You can not sleep, not have a libido and still be anxious. And you can't, you have to talk to your practitioner and walk them through what you're doing and don't just accept it. That's, we are our biggest health advocates. And because we go to a doctor or practitioner, we hand over our power and are like, here, do whatever you want to do to my body. Just go ahead, whatever you want to put in and inject, whatever. And it's no, that this is really sacred.
Yeah.
Really be mindful of what we're putting into our mouth, how we're moving, how we're resting, all of that. So don't get me started. Anyway, okay, I started a little bit.
I totally egged you on.
So getting back to the limbic system, the limbic system really responds well to regular exercise. That is so key because you want to get blood flow to all areas of the brain. And because the limbic system takes up so many parts of the brain, you want to get blood flow in there so much. So, you can have your limbic system can be too low, meaning there's not quite enough blood flow there. And so you have less reactivity to things. And it's really too low and less, low motivation and all of that, or it can be too high where there's pain and sensory overload and, cyclical mood changes and high depression and all of that. Either way, and the hardest part is when you feel like that, you do not feel like exercising. So for me, when I know my limbic system has been affected, if I cannot force myself to exercise, I will, ask a friend to exercise with me, or I'll, if I'm able to that time, I'll pay a trainer and, have them force me to exercise. something to be able, because I know how vital that is to be able to get blood flow in that area.
Well, and you can tell what type of exercise, because as much as I know it's important and I like to do it, still doing anything by myself, even if I'm like jamming out to my favorite song, is still very challenging for me because I'm a limbic brain type. I have to exercise with other people.
Right.
I had, which again, one of the major reasons that the past several months have been so hard. I had a scheduled group activity every week, and I would just be elated for the entire next day because I exercised. It was fun. I didn't feel like I was exercising, like it didn't feel boring or annoying. And I got to hang out with my friends. It's like a win-win. So if you're doing what you think are the right things with exercise and it's still not working, that's when the brain health assessment is helpful and can kind of validate those things. And even if just being completely silent in a room with other people doing yoga, I still feel like I'm getting the oxytocin because we're in a group setting together. So even if you are feeling like you would be better at that, but you don't necessarily want to be as interactive and you want to stay 6 feet apart and all of that, you can still do that. But for me, it's just so crucial. And then definitely, we were talking about scents. Like I love the smell of fresh cut grass. Like it just makes me want to go out and play. So have that positive association. I use a lemon essential oil every day because it's just a very happy scent to me, lemonade as a kid and all that stuff. And obviously I don't drink anything like that anymore, but I get that fix. And you just continue setting up positive sense for yourself. It's weird once you start thinking about this stuff and digging into it, how you react to certain things. Cause I am very sensitive to smell. Like I can smell like everything always. Person to have around if there's a fire nearby, so I can smell it like far away. But anytime I smell anyone around me that is wearing Cool Water, that like perfume, it really makes me like super sad and guilty because that was what I wore in high school when I was like a hot mess. And so it's just when you start thinking about that stuff, it's like everything is filtering through your limbic system and being processed. And if you don't know why all of a sudden you're feeling sad and guilty out of nowhere, you're at the grocery store and you don't realize it's the person next to you wearing it. And all of a sudden you just start getting all these thoughts. It's just good to be self-aware of those things. Even if it's just writing down like my favorite scents are, my least favorite scents are, and just starting to track that. Super helpful. I mean, I can't tell you how many lemon cake candles I have from Trader Joe's. Like I just like hoard them because they're really small and they go out really fast. But to me, it's like the happiest smell. I love it.
Yeah. Yeah. And that's that self-awareness piece. And so working with a brain health coach, I think is so vital to be able to start looking at all of that because it's, you may not know all of these different pieces. And so, that's such a good example because like you can be in the grocery store and they, somebody can be by you and then you're sad for the rest of the day and you don't know why you're sad. And then you feel really out of control. And then you go to the doctor and you ask for an antidepressant.
Sorry for laughing, but yeah, like that
does not make any sense. So now you're going to throw all these other systems out of balance because you smell something that somebody had on at the grocery store. Like that, that just doesn't make sense. So, but it makes sense until you know that it doesn't make sense. Like once you
exactly
know it. And that's, what the brain health coaching is to be able to bring that awareness at all levels of your being. With the brain expertise to be able to know what's going on in all these different parts of the brain and how are they interacting. So, yeah.
Yay. I think that's a good place to stop.
Okay. Well, I would just say too, if the deep limbic system is working with a therapist, I think is really, really helpful to be able to work with how to get along with others and that kind of thing. If that piece is difficult for you, that counseling therapy piece is really, really important to find a good counselor.
And I think that's something I also forget sometimes to let people know, especially if they're tuning in for the first time. I mean, when I started working at the clinic doing intakes 7.5 years ago, I was surrounded by therapists. All of my colleagues were therapists and counselors. And still to this day, most of my best friends are counselors, and I have my own therapist. So it's not like I just like magically learned all of this, either
Right.
myself or just with a coach. I mean, that therapy piece is so big. I cannot even put into words how important that is
Right.
for learning these things about yourself, and just overall being able to respond the way that you want to respond in the world is kind of how I view the goal of therapy. Because I feel like there are so many different types, and there's so many different providers, and there's people that you go to and they're like, you know, if you want to get to this goal in 6 months, we're going to have to go really hard, versus someone that's like, we're going to go at a very comfortable, loving pace, and I'm going to support you every step of the way. We're not even going to talk about how long we need to see each other, because I'm very confident we're going to get what we need out of every appointment.
Mm-hmm.
That's something to think about. Definitely choosing the best therapist for you, which involves research, referrals, all types of things, which I am more than happy to help. I mean, I have a network of thousands of providers across the country. So if that's something that you feel like you want to work on, please let me know.
Mm-hmm. Yeah, absolutely. And I think to me that what comes out of therapy is not only the self-awareness, but the empowerment to be able to make different decisions and to be able to shift perspective. Because really, at the end of the day, like the only thing that we have control over is our perspective. And so what are we putting into that, and how are we educating ourselves around that perspective piece? So, yeah.
Love that.
Yes.
Yay. What do we want to talk about next week?
So let's see, we've done, if anybody is looking for the anxiety, we've done the basal ganglia. Have we done the prefrontal? We did prefrontal cortex.
I don't know if we've done a lot more storytelling though, which is very fun.
Okay, or the cingulate gyrus. Did we do the CG?
No.
Okay,
Also
let's do
good
the
storytelling.
I'm sorry?
Also good for storytelling.
That's true. That's true. So the cingulate gyrus is about cognitive flexibility and being able to shift ideas and have flexibility and adaptability. So if you know anybody in your life that does not have the ability to adapt to different things or transition easily from one thought to another or one activity to another, tune in next week at 11 o'clock Eastern time on Tuesday, and we will be tackling the cingulate gyrus.
I am really excited because mine was a hot mess, and I actually did therapy about my relationship with my anterior cingulate gyrus. So we can talk about that.
Yes.
I was mad at the area of my brain that was making me mad.
And then it gets you really mad.
Exactly. And then I can't stop thinking about it. Yeah, well, I'm excited. I hope you have an awesome day, Whitney. Thank you so much, as always, for everything. And I hope everyone has an awesome week.
Thank you. Thank you so much.